Lecture number 10, Chronic Porphyria. The chronic porphyria are dermatological diseases that may or may not involve the liver and nervous system. Influenced by exposure to sunlight and HIV infections. Urine appear pink to red color in fluorescent light. So, these are the dermatological diseases that may or may not involve the liver or the nervous system. This syndrome includes four types: erythropoietic porphyria, porphyria cutaneous, congenital erythropoietic porphyria, or we call it a gunther disease, and hepatoerythropoietic porphyria. So first is the erythropoietic porphyria. It arises from the deficiency in the enzyme ferrochelatase, leading to abnormally high level of protoporphyrin in the RBC, plasma, skin, and liver. Actually, iron is not inserted in the protoporphyrin ring, and since iron is not inserted in the protoporphyrin ring, then the heme is not formed. Heme synthesis is decreased. Heme synthesis is decreased, but the message goes that heme is not synthesizing, and cell thinks that delta amino levulinic acid synthetase is deficient, and therefore the synthesis of the enzyme is increased and the delta amino levulinic acid is increased, and overproduction of type 1 uroporphyrin and coproporphyrin take place. Here you can see ferrochelatase enzyme, and it is absent, and so iron is not inserted inside the heme, and the formation of the heme is decreased. What are the clinical aspects? Photosensitivity. The accumulated protoporphyrin molecule can be stimulated by absorbing light energy. And when light is involved, then there is an interference with the redox system, electron transport system. Free radicals are generated, and you know that when the free radicals are generated, then they are hazardous to the skin as well the liver and other important parts of the body. So free radicals are generated, and thus increasing the photosensitivity of all the tissues exposed to light. And you know that free radicals, they always cause damage to various organs. So what happens that the accumulated protoporphyrin molecule, which has not converted to heme, it is stimulated by absorbing the light energy, and this, when the light energy is absorbed, then interference with the redox system is produced, that is the respiratory chain transport of the electrons, the hydrogen ions release, and in this way the free radicals are generated, and thus increasing the photosensitivity of all tissues exposed to light. Hematological abnormalities and liver disease is also observed, and several other toxic mechanisms involved in the deposition of protoporphyrin crystals in the hepatocyte and bile calculi are activated, and in this way the toxic chemicals, they are deposited in the hepatocytes. The hepatic effect of the disease is that the liver enzymes are elevated, and this may lead to the hepatic failure, leading to death. Porphyria cutaneous, a porphyria that affects the skin, cutaneous, skin. Porphyria cutaneous is characterized by the defective uroporphyrin 3 decarboxylase enzyme. It is the most treatable type of porphyria, porphyrinogen 3 decarboxylase enzyme. There are three types of Porphyria cutanea tarda with typical skin manifestations such as skin fragility, erosions are there, vesicles in sun exposed areas of the skin, and sometimes there is the presence of hyperpigmentation or ulceration. If you want to see the deficiency of enzyme or the substrates and the products, then you can go to the diagram. Here you can see the decarboxylase enzyme. Uroporphyrinogen 3 decarboxylase enzyme is deficient, and uroporphyrinogen 3 is not converted to coproporphyrinogen 3. Urine contains large amount of type 3 uroporphyrin, uroporphyrin 3, coproporphyrin 3, and these are actually present as zinc complexes. Serum iron is increased. Symptoms are related to alcohol or iron overload, hepatic injury. Serum iron is increased, obviously, and serum iron is increased, then there are chances of hepatic injury. Congenital erythropoietic porphyria, which is also known as a gunther disease. It is a erythropoietic porphyria or gunther disease. It is the least common type of porphyria, and it results due to the deficiency of uroporphyrinogen 3 synthase enzyme. Increased porphyrin production is there, and excretion of porphoglinogen and delta aminolevulinic acid takes place. Which enzyme is deficient? Uroporphyrinogen 3 synthase. Uroporphyrinogen 3 synthase is there. Porphoglinogen is increased, delta aminolevulinic acid is increased because the cycle is blocked here and the cycle does not pass onward. Clinical symptoms. Skin problem is there. Prolonged exposure to sunlight may precipitate a blistering rash. ब्लिस्टरिंग रैश छाले हो जाते हैं और उनमें जलन होती है, रेड यूरिन फॉर्मेशन एंड इवन ब्लाइंडनेस. Skin lesions are developed. Bone and teeth become pink and brown due to the porphyrin deposition. Hematological variations. Porphyrins are accumulated in the RBC and cause hemolysis. Red color urine is excreted since due to increased porphyrin production, uroporphyrin 1 and uroporphyrin 3 are largely produced and they are of red color. Porphoglinogen and delta aminolevulinic acid are excessively produced. You have seen this, but they are colorless. But on air exposure, if the urine is left in air, then after some times you can note the color in the patient's urine. It will be of red color because on exposure to light, to air and light, they polymerize to form red color compound porphobile. Hepatoerythropoietic porphyria. Hepatoerythropoietic porphyria is a very rare form of hepatic porphyria, and it is caused by a disorder of the gene which code uroporphyrinogen 3 decarboxylase. It has similar presentation to Porphyria cutanea tarda. That is, you can see the skin symptoms which are developed in the Porphyria cutanea tarda, but the difference is that this disease is developed in early childhood. Level of uroporphyrinogen decarboxylase are low in the erythrocytes. Here you can see the uroporphyrinogen 3 T-carboxylase. It converts uroporphyrinogen 3 to coproporphyrinogen 3. Then in the next lecture, we will discuss the mixed porphyria and the acquired porphyria. The mixed porphyria, they are produced, or you can say they have a mixed symptoms of both acute type and the chronic type. Liver, neuro, and the cutaneous type. Skin is affected, nervous system is affected, and sometimes the liver is also affected. Acquired porphyria means that certain factors they trigger the occurrence of the porphyria. Right? They are acquired due to some factors. They are not inherited, right? But some factors, some other diseases, they lead to this type of porphyria.